have this intense fear of talking to strangers, eating or drinking in public, speaking in meetings, or being watched, or the fear of being watched while doing something, sweating, blushing, trembling, or having a rapid heartbeat, or nausea, or a dry mouth when you are in social situations, then you might be suffering from something called as a social anxiety disorder. And other symptoms of this disorder also include avoiding social events, arriving late or leaving early, or over preparing for conversations to avoid mistakes. If you are someone who worries for days or weeks before an event, replaying every interaction afterwards, and assuming others are judging you partially for everything that you have done in that social situation. This often tends to start in adolescence and can range from mild where you have only certain situations that trigger it to severe where it interferes with work, relationships, and daily life. Now, why does this happen? It is usually a mix of genetics, or it could be because of imbalances in serotonin or other neurotransmitters, or it could be a learned behavior like growing up in a highly critical environment, or negative social experiences like bullying, embarrassment in childhood. Here are some evidence based ways to manage and overcome. It includes cognitive behavioral therapy, and cognitive behavioral therapy is considered as a gold standard because it helps you identify and challenge the thoughts that fuel anxiety. Example, the thought that everyone will think that I'm stupid if I stutter. This kind of exposure therapy is a key part of cognitive behavioral therapy, and it gradually puts you in a feared situations in a safe and controlled way, and that helps you grow out of it. The second comes medication. SSRIs or SNRIs these are first line in case of moderate or severe cases. They reduce physical symptoms and make therapy even easier to engage in. Beta blockers like propranolol can also help with performance anxiety like public speaking. Some self-help strategies include practice of gradual exposure, like you need to start small, like making eye contact and then gradually building it up. You also need to challenge negative thoughts, like you need to ask what exactly is the evidence that this will actually happen. When you keep questioning your negative thoughts, the effect of these thoughts on your anxiety reduces. You need to limit safety behaviors like pausing conversations endlessly has to stop. And definitely the lifestyle changes like regular exercise, good sleep, and reducing caffeine or alcohol, and mindful practices like meditation always lower the baseline activity. And the most important thing to know here is that you're definitely not alone. About 7 to 13% of the people experience social anxiety disorder, and I am no exception to it. What is important here to know is that social anxiety is not a character flaw. It's just a real condition that responds very well to treatment. And it is important that you see a psychiatrist and talk to them about your condition and do not self medicate or do not